Hello and welcome to this week's mini session, which is about health anxiety. Health anxiety is something that I have experienced in my life, and from a personal experience, I will describe it as my mind noticing physical symptoms of sickness or illness, and my mind worrying excessively about those symptoms and categorizing them in a way that leads me to believe and fear that I might have a serious illness. So it's really common. I'm not sure what the percentage is, but a lot of people do have health anxiety. You know, some people might say hypochondria. I think the reason why I wanted to talk about it is because I do have a lot of conversations in private sessions about health and people worrying. So I just want to put it out there. It's normal to have concern about your health, but it's not helpful to worry. And remember, anxiety is about the future. So health, anxiety, worrying about my health in the future. And the most, helpful practice as an antidote to anxiety about your health is self-trust. And is also attunement to your mind and body. So if you can develop a good and intuitive connection with your body and your mind, you will be able to decipher between a common cold and something that's developing pneumonia or whatever it is that you might be worrying about. You will intuitively know for sure that you're not critically or becoming critically ill, that you've just got a bad cold. So I think there's an inner world practice to do with health anxiety, and that's self-trust, so reassurance. I trust I'll know when it's time to seek medical attention. I trust I'll be able to cope if I do end up getting quite sick. I trust I'll be able to cope with the challenges that may present. And then the practical step in dealing with health anxiety is, if you have been worrying excessively for a significant period of time about a particular condition you fear you may have, go and get a test. Go and see your GP. Tell them, look, I think it's just anxiety. I think I'm just worrying, but it's been there for a while. I've done some practice to try and not worry, but it's not going away. Can you write me a referral to see the specialist to have my moles checked, or whatever it is? And when that result comes back, that is your confirmation that everything is A-okay. There's nothing to worry about. And then you practice self-regulation when anxiety rises again. And you reassure yourself with that self-trust mantra. I trust I'll know what to do if something serious develops, and I trust I'll be able to cope with the experience of that. So if you do notice that you're worrying, there's a couple of practices. An internal world practice to reassure yourself. Of course, you should also be seeking support from your inner sanctum, from your partner and the people around you. And if you're unable to unhook from this anxiety, this neurosis of worry about becoming critically or fatally ill, go and see your GP, get a referral, get it checked out, get the peace of mind you need, and get on with your life.